At the recent meeting of the 64th World Health Assembly in Geneva, delegates spoke, amongst other things, of global health diplomacy, the art of getting international agreements on public health issues where it's not just medical evidence that counts.
Health challenges today are complex and rooted in social, political, and economic determinants. They are wide-ranging and readily cross national borders. They require global action well beyond the health sector and have brought diplomats into health debates. Without engaging foreign policy, how can we address the world's most pressing health issues? How will we reach the MDGs?
Those Millennium Development Goals were challenged in Nigeria in 2003 when the medical evidence showed that polio vaccination was effective in eradicating the disease. But the immunisation programme was stopped in one area because a local governor claimed it was part of a Western plot to sterilise Muslim girls. Global health diplomacy was essential to restart vaccination, and the first step was retesting the drug to show it was safe.
The second step was diplomatic negotiations within the Islamic Conference in Islamic countries to invite religious leaders to help resolve the issue, either through fatwas or actual demonstration of vaccination in northern Nigeria. This began to have an effect, but the situation was not resolved until the governor himself decided that he needed to resolve the issue, and he then sought a group of pediatricians who helped him decide that the risk of polio was greater than the risk of vaccine.
Former executive board member of the WHO, Paolo Bus, told me this happens often, that cultural, financial or trade barriers need to be overcome, as well as the interests of the pharmaceutical companies.
We have to learn to work together with diplomats. And not only diplomats. The question is intersectoral, because you have the Minister of Foreign Affairs, but also the Minister of Economy, very important in influencing health and the organization of the health work in these countries. So the health diplomacy is a field that has much more than doctors and diplomats.
It can mean something else for every country. It can then mean negotiating the access to the medicines. It can mean negotiating the responsibilities of the respective countries, the responsibilities of their ministries of health. It can mean negotiating who pays for this. It can mean negotiating who controls it. So while the public health issue might seem very clear, getting agreement is yet another part of the story.
On the banks of Lake Geneva stands the Graduate Institute of International and Development Studies, which does research and runs courses both here and abroad in global health diplomacy.
We have health diplomats, or people who want to become health diplomats from all around the world, who come and learn about the context of global health diplomacy, how it is conducted, the system of global health diplomacy. They hear from experienced negotiators, they role play, and they just learn to understand this system of negotiation and how you negotiate better.
It's at gatherings like here at the World Health Assembly in Geneva that a lot of global health diplomacy goes on, both at informal meetings over lunch and also at more structured negotiations. And there's a skill in applying many different approaches in securing global health agreements. It's here that big names such as the former Director General of the WHO, Halfdan Mahler, can be found, the Executive Director of the Global Fund, Michel Kazachkin, and more. The discussions go on with spreadsheets and laptops, and perhaps a little cajoling or flattery too. Global health diplomacy led to the WHO's first International Health Treaty in 2003, the Framework Convention on Tobacco Control, completed in a relatively short 3 years. It was a learning experience.
One of the lessons of the success of the negotiations was that it was led by strong diplomats who may not know much about public health, but what we needed to negotiate a treaty. The important thing is that during this process, we saw that we came up with a new quality of people who had both already at the end of the process. You could see strong public health people already with very good negotiating skills and almost already accomplished health diplomats.
Global health diplomacy is playing an increasingly vital role in improving health worldwide. Political, fiscal and social considerations are as important as medical evidence in reaching agreements that all can sign up to.